Hello and welcome to Dr. Sushant's anatomy tutorial. In this video, I'm going to talk about the flexor retinaculum of the hand. I will also talk about the carpal tunnel syndrome, that is due to the compression of the median nerve deep to the flexor retinaculum. Now, what is flexor retinaculum? Flexor retinaculum is one of the three modifications of deep fascia of the palm. So in the palm, we have these three modifications of the deep fascia. There is the palmar aponeurosis, which is seen here, also known as the palmar fascia. And then there is flexor retinaculum, which is a band-like structure. And there is the fibrous flexor sheath, that is for the flexor tendons, in order to keep these flexor tendons in place. So in this video, I'll be focusing mainly on the flexor retinaculum. Now, we will discuss the flexor retinaculum under these headings. So I will talk about its definition, its attachments, its relations. And also I will talk about applied anatomy of the flexor retinaculum. So in this picture, the flexor retinaculum is seen here. It is nothing but a thickening of the deep fascia in front of the wrist. So what is flexor retinaculum? So if you ask me the definition of the flexor retinaculum, the flexor retinaculum is actually a strong band. It's a fibrous band. It's a strong sheet of fascia. So it's actually a strong band of deep fascia that is found in the palm. In this picture, we can see this structure highlighted is the flexor retinaculum. This is a thickening of the deep fascia, otherwise it's a thickening of the deep fascia, and it lies in front of the wrist, This actually acts as a tie beam, and it prevents the bowstringing of the long flexor tendons when you flex your wrist. So we know the tendons will not pop out when you flex your wrist, and the reason for this is that the band-like flexor retinaculum keeps all these tendons in their original position. Now, when this flexor retinaculum is attached across the concavity of the wrist, it converts the area deep to the flexor retinaculum into a tunnel, which is known as the carpal tunnel. So what is carpal tunnel? It's a tunnel-like area beneath the flexor retinaculum due to the bridging of the pillars, the medial and the lateral pillars of the carpal bones. And this area, this region, is like a passage going from the forearm into the palm, and this is known as the carpal tunnel. And it is passage for the long flexor tendons, nerves and vessels to pass from the forearm to the hand. Now, what are the attachments? We'll talk about the attachments of the flexor retinaculum. So the flexor retinaculum has a medial attachment. So medially, it is attached to these bones. What are they? The pisiform bone and the hook of the hamate bone. So medially it is attached to the pisiform and hook of hamate bone. All right. And laterally, what is the lateral attachment? Laterally, it is attached to the tubercle of the scaphoid bone and the crest of the trapezium. Laterally, it is attached to the tubercle of the scaphoid bone, and it is also attached to the crest of trapezium. Those are the attachments. Okay, so we also have additional attachments of the flexor retinaculum. Medially, there is a superficial slip, and laterally there is a deep slip extending from the flexor retinaculum to be attached to these bones of the carpus or the wrist. So superficially, there is going to be a superficial slip. Medially there is going to be a superficial slip, and this superficial slip is again attached to the pisiform bone. All right, as you can see in this picture, or I will show another picture where I will draw and show you the attachments of the flexor. At this point of time, just remember that this flexor retinaculum is band like this. So on the medial aspect, it has got a superficial slip, and on the lateral side, it has got a deep slip. All right, those are extensions from the flexor retinaculum. So medially it will be attached to the pisiform bone, and laterally it is attached to the trapezium, medial to the groove on the groove of the trapezium bone. So just remember this, I'll illustrate this anyway. Now what happens to the flexor retinaculum proximally and distally? Now proximally the flexor retinaculum blends with the antebrachial fascia, or the fascia of the forearm, and especially the fascia covering the flexor digitorum superficialis. And what happens to the flexor retinaculum distally? Distally, the flexor retinaculum becomes continuous with the palmar aponeurosis. So we know what palmar aponeurosis is, don't we? So the palmar aponeurosis is the distal attachment of the palmaris longus muscle, which is actually a degenerated insertion of the palmaris longus muscle. So the flexor retinaculum distally becomes continuous with the palmar aponeurosis, and these flexor retinaculum and the palmar fascia together provide origin to the thenar and the hypothenar muscles of the hand. Right. Now let us talk about the relations of the flexor retinaculum. So I'd like to show you the relations of flexor retinaculum by drawing a diagram of the flexor retinaculum. It's going to be a very simple diagram for all of you to remember. So I will draw the flexor retinaculum as it is attached to the bones of the proximal and the distal rows of the carpal tunnel. All right, the bones of the carpus. Well, let me begin with the drawing the proximal row. All right, so the first bone I'm going to draw here is the pisiform bone. All right, and then we got the triquetral bone here. This is the triquetrum. And then there is the lunate bone. All right, the lunate bone here. And then there is the scaphoid bone with the tubercle. Right, so this is the proximal row. These are the bones of the proximal rows. Now where is the flexor retinaculum attached? So here is the flexor retinaculum attached across the carpal bones, converting this into a tunnel known as the carpal tunnel. All right, so the structure that I just drew is the flexor retinaculum. Now if you remember, I told you on the medial aspect has got a superficial slip, and this is called the volar carpal ligament. This is the superficial slip of the flexor retinaculum, and the deep slip, I will show the deep slip in another diagram. So this is the superficial slip of the flexor retinaculum. So what do we see here? We see this bone. This is our pisiform bone, and here we have, what is this bone? This is your triquetral bone, and here we have the lunate bone here, and this one right here is the scaphoid bone. So these are the bones of the proximal row, and this structure here is the flexor retinaculum, and this one is this is obviously medial, so obviously lateral, isn't it? So medially, this particular structure here is the superficial slip of the flexor retinaculum, superficial slip, which is also known as the volar carpal ligament. All right. Now this region beneath the flexor retinaculum is called the carpal tunnel. All right, this is called the carpal tunnel. And then so let me draw the other row, the second row as well. So I will begin with drawing the hamate bone. This is the hamate bone with its hook. So this is the hook of the hamate bone. The next bone is the capitate bone. This is how roughly how they will appear when you take a section of the carpus. And this is your trapezoid bone. And then we have the trapezium. This is the trapezium bone. All right, now what we have here, okay, let me repair this a bit. This isn't the best diagram, I know. All right, so here is the crest of the trapezium. Now let me draw the flexor retinaculum here. So here is the flexor retinaculum extending from the hook of the hamate to the crest of the trapezium. All right, this is the second row bones, and here is the deep slip of the flexor retinaculum, which is attached to the trapezium, medial to the groove of the trapezium. So let us label these bones. So this bone is the hamate bone with its hook. This one right here is the capitate bone, and this is the trapezoid bone, and this is the trapezium bone. So here is the flexor retinaculum with its deep slip, but this is the deep slip. Okay, so look at this. This is the superficial slip, this is the proximal row. All right, this is the proximal row of carpal bones, and this is the distal row of carpal bones. So we see the proximal and the distal rows of the carpal bones here and the flexor retinaculum. So very simple concept. You have the flexor retinaculum is like a band, and it is attached to the bones of the carpus, that is medial and the lateral pillars. So laterally it has got a deep slip, medially it has got a superficial slip. Right, now if I write down the attachments, medially the flexor retinaculum would be attached to the pisiform bone and to the triquetrum. Okay, I mean yes, so a little bit of extension into the triquetral bone, but mainly medially it would be attached to the pisiform bone. Okay, and that is from the proximal row, and on the distal row it would be attached to the hook of the hamate bone. Okay, so hook of hamate bone. So this is the distal row. Okay, so medial pillars of the carpal tunnel are formed by the pisiform bone and the hook and the hamate bone. So the attachment would be here, as you can see. So this is the medial aspect, this is medial aspect, right? So this is proximal, this is distal. So proximally you can see the bone, the flexor retinaculum is attached to one, that is pisiform bone here, and secondly it is attached to the hamate bone as well. All right, so the medial attachment of flexor retinaculum is this. Now when you look at the lateral attachment of the flexor retinaculum, so laterally the flexor retinaculum would be attached to the tubercle of the scaphoid bone. Okay, tubercle of scaphoid, this is the proximal row of the carpal tunnel, and then it is also attached to the crest of the trapezium. Crest of trapezium, which is in the distal row. So let us look at the picture again. So this is lateral, and here we can see it is attached to the scaphoid bone, that is to the tubercle of the scaphoid bone in the proximal row, and it is also attached to the trapezium bone, that is to the crest of the trapezium. This is the crest of the trapezium in the distal row. All right, so the attachments, the additional slips on either side, a superficial slip on the medial side, it's also known as the volar carpal ligament. It is attached to the pisiform bone. All right, it is attached to the pisiform bone, and then we have the deep slip, which is on the lateral side. The deep slip on the lateral side. This is lateral, isn't it? Yeah, this is lateral. So it is attached to the lateral deep slip is attached to the medial lip of the groove of the trapezium. So this one right here, let me show you this depression here. This is called the